Hi friends, welcome to the channel Nurse App. Today we will discuss some important nursing MCQ on respiratory system. If you are seeing for the first time this channel, please like, share and subscribe my channel for more nursing related videos. Let's begin our class now. First question, the main muscle of inspiration. Option A, diaphragm. Option B, rectus abdominis. Option C, scalenus anterior. Option D, internal intercostal. Which is the main muscle of inspiration? Option A, diaphragm. Which of the following drug is not available as metered dose inhaler? Option A, salbutamol. Option B, terbutaline. Option C, albuterol. Option D, aminophylline. Which drug is not available as metered dose inhaler? Correct answer is option D, aminophylline. Salbutamol, terbutaline and albuterol is available as a inhaler, MDI or metered dose inhaler. Capnography is a measurement of option A, bicarbonate concentration, option B, H plus ion concentration, option C, CO2 concentration, option D, anion gap. Capnography is a measurement of partial pressure of carbon dioxide. So, correct answer is option C, CO2 concentration. Capnography is a non-invasive measurement of PaCO2. That means it shows how much carbon dioxide is present at each phase of respiratory cycle. So how it measures? It measures through a metric known as end tidal CO2 or EtCO2. What is the normal range of PaCO2 in blood? That is 35 to 45 mmHg. Clear? A client with COPD is admitted to the respiratory unit. Which physician order the nurse should question? Option A, O2 at 5 liters per minute by nasal cannula. Option B, Solometrol 125 mg IV push every 6 hours. Option C, ceftriaxone 1 gram, that is Rosofin IV daily. Option D, Darvocet N 100 PO PRN pain. Correct answer is option A, O2 at 5 liters per minute by nasal cannula. Why the nurse should question this order? Because in COPD patients, we are administering only 2 to 3 liters of oxygen per minute. If we will administer excessive amount of oxygen, what will happen to the patient? There will be CO2 retention. It may cause drowsiness and headache-like symptoms, and in severe cases, there will be lack of respiration and which may lead to death. And also raising the oxygen will suppress the patient effort to breathe. Identify the image shown below. Option A, ET tube. Option B, nasopharyngeal tube. Option C, oropharyngeal tube. Option D, Goodal airway. Correct answer is option A, ET tube. Identify the image shown below. Option A, Buska mask. Option B, Combi tube mask. Option C, Ambu face mask. Option D, supraglottic mask. Correct answer is option C, Ambu face mask. Identify the image shown below. Option A, cricothyroidotomy tube. Option B, Goodal airway. Option C, ET tube. Option D, laryngeal tube. Correct answer is option A, cricothyroidotomy tube. Identify the image shown below. Option A, laryngeal mask airway. Option B, igel airway. Option C, Buska mask. Option D, Combi tube. What is this? Option A, laryngeal mask airway. Identify the image shown below. Option A, laryngeal mask airway. Option B, igel airway. Option C, Buska mask. Option D, Combi tube. What is this? This is option D, Combi tube. Identify the image shown below. Option A, laryngeal mask. Option B, non-rebreather mask. Option C, Buska mask. Option D, face mask. Correct answer is option B, non-rebreather mask or NRBM. Identify the image shown below. Option A, chest tube insertion. Option B, central line insertion. Option C, central line removal. Option D, pelvic drain removal. What is this procedure? Correct answer is option A, chest tube insertion or ICD insertion, intercostal drainage insertion. Nurse performing suctioning tracheostomy would know that the suction pressure should not exceed option A 120 mm of Hg, option B 160 mm of Hg, option C 140 mm of Hg, option D 180 mm of Hg. What is the suction pressure for doing suctioning tracheostomy? It is option A 120 mm of Hg. Thoracentesis is contraindicated in patients with A. Bleeding and clotting disorders, B. Severe cardiac problems, C. Uncooperative client, D. All. Correct answer is option B. Severe cardiac problems. Stimulation of vagus nerve results in A. Decrease in heart rate, B. Increase in heart rate, C. Dilatation of bronchioles, D. Dilatation of coronary artery. Correct answer is option A. Decrease in heart rate. Prolonged clamping of chest tube will result in option A. Atelectasis, option B. Tension pneumothorax, option C. Emphysema, option D. Pneumonia. Correct answer is option B. Tension pneumothorax. Injury to the which nerve cause vocal cord palsy? Option A. Nasopharyngeal nerve, option B. Recurrent laryngeal nerve, option C. Acoustic nerve, option D. Spinal accessory nerve. Vocal cord palsy is due to the injury to recurrent laryngeal nerve. Correct answer is option B. The normal mean pulmonary artery pressure is option A 5 to 10 mm Hg, option B 10 to 20 mm of Hg, option C 20 to 30 mm of Hg, option D 30 to 40 mm of Hg. Mean pulmonary artery pressure. Correct answer is option B 10 to 20 mm of Hg. Which of the following drugs of Dodd's therapy can cause deafness? Option A. Ethambutol, option B. Streptomycin, option C. Isoniazid, option D. Rifampicin. Correct answer is option B. Streptomycin can cause ototoxicity which will lead to deafness. Complication of bronchiectasis is option A. Cerebral abscess, option B. Lung abscess, option C. Amyloidosis, option D. All of the above. Correct answer is option B. Lung abscess. Which of the following lung volume is the base of functioning of Helmholtz maneuver? Option A. Tidal volume, option B. Inspiratory reserve volume, option C. Residual volume, option D. Total lung capacity. Correct answer is option C. Residual volume. What is residual volume? The volume remaining in the lungs and airways following a maximum expiratory effort. What is the total lung capacity? It is 5,800 to 6,000 ml. Inspiratory reserve volume means the amount of air that a person can inhale forcefully after normal inspiration. It is 1,900 to 3,300 ml. What about tidal volume? The amount of air moves in and out of the lungs with each respiratory effort is called as tidal volume. What is the normal value? 500 ml in a healthy male and 400 ml in a healthy female. In ABCDE for trauma patients, E stands for A. Evaluation, B. Exposure or environmental control, C. Education, D. Evaporation. Correct answer is option B. Exposure or environmental control. What is ABCDE? Airway, breathing, circulation, disability and exposure. Lemon score is used to assess option A. Assessment of bleeding, option B. Assessment of difficult intubation, option C. Assessment of GI tract, option D. Assessment of head injury. Correct answer is option B. Assessment of difficult intubation. This is the lemon score. The mnemonic used it to assess difficult intubation. L stands for look externally. There are 4 subcategories: facial trauma, large incisors, beard or mustache, large tongue. Each one will be given with 1 point. E for evaluate the 332 rule. Incisor distance 3 finger breadth 1 point. Hyoid mental distance 3 finger breadths 1 point. Thyroid to mouth distance 2 finger breadths 1 point. M stands for Mallampati score, that is greater than 3 means 1 point. O stands for obstruction, presence of any conditions like epiglottitis, peritonsillar abscess, trauma, it is 1 point. N stand for neck mobility, that is limited neck mobility 1. Total score will be 10. Blue bloater is also known as A. Chronic bronchitis, B. Chronic asthma, C. Pneumonia, D. Emphysema. Correct answer is option A. Chronic bronchitis. A suspected atelectasis client, which clinical manifestation nurse expected to identify when assessing the client? A. Slow deep respiration, B. Normal oral temperature, C. Dry unproductive cough, D. Diminished breath sounds. Correct answer is option D. Diminished breath sounds. An adult's respiratory rate is 12 per minute and tidal volume is 500 ml. What is the pulmonary ventilation? A. 6 liter, B. 7.5 liter, C. 8 liter, D. 5 liter. Correct answer is option A. 6 liter. If a client's normal respiration and tidal volume is given, how will you find the pulmonary ventilation? Pulmonary ventilation is equal to normal respiration into tidal volume. Here the normal respiration is 12 and the tidal volume is 500. So it is 6000 ml. That means 6 liter. Parasympathetic stimulation reach at lungs via A. Spinal accessory nerve, B. vagus nerve, C. facial nerve, D. brachial plexus. Correct answer is option B. vagus nerve. Vagus nerve stimulation effect with respiration. A. tachypnea, B. bradypnea, C. Boots respiration, D. chain stroke respiration. Vagus nerve stimulation effect with respiration. Correct answer is option B. bradypnea. Which provide the greatest surface area for gas exchange? Option A. alveoli, option B. alveolar sac, option C. respiratory bronchioles, option D. alveolar duct. Correct answer is option A. alveoli. A nurse assessing for tactile fremitus. The client would most likely exhibit an increased tactile fremitus with option A. emphysema, option B. pneumonia, option C. pneumothorax, option D. lung cancer. Increased tactile fremitus. Correct answer is option B. pneumonia. What is tactile fremitus? Palpable vibration of the chest wall that results from the transmission of sound vibration through lung tissue to the chest wall. The examiner places his hand over the scapula of the patient and he will ask the patient to repeat the phrase 99. From this one we can assess the vibration and the density of the lungs. Increased tactile fremitus indicate denser or inflamed lung tissue. Example pneumonia. In case of pneumonia, what will happen? The lung tissues become inflamed. Decreased tactile fremitus indicate air or fluid in the pleural cavity. Example pneumothorax, emphysema, lung neoplasm, hemothorax, pleural effusion, obesity, COPD, etc. This is how they are assessing the tactile fremitus. It is the vibration of chest wall and the examiner feels for the changes in the intensity of fremitus by palpating the chest wall and asks the patient to repeat the phrase. Decreased fremitus is caused due to the excess air in the lungs or increased thickness of chest wall, and increased fremitus is due to the lung consolidation, that means inflammatory exudate, blood, pus or cells. Barrel chest occurs in option A. emphysema, option B. empyema, option C. pleural effusion, option D. pneumothorax. Barrel chest in the case of option A. emphysema. A disease condition characterized by excessive mucus collection and collapse of alveoli is option A. atelectasis, option B lung cancer, option C pleural effusion, option D pneumothorax. Excessive mucus collection and collapse of alveoli. Correct answer is option A atelectasis. Empyema means A. Collection of fluid in peritoneal cavity, B. Collection of fluid in pleural cavity, C. Collection of pus in pleural cavity, D. New growth in the lungs. Empyema. Correct answer is option C. Collection of pus in pleural cavity. A disease condition caused by bacteria and characterized by fluid-filled alveoli and inflammation is A. Pneumonia, B. SARS, C. ARDS, D. Atelectasis. Correct answer is option A. Pneumonia.